Hi everyone, my name is Vivienne Browne. I'm the Associate Director of Government Relations and Policy at Orygen, which is a youth mental health research centre associated with the University of Melbourne in Victoria, Australia. I'm really pleased to present to you today the U21 Declaration on University Mental Health and Wellbeing. The declaration has been endorsed by the U21 Leaders Group and provides universities across the network with 5 guiding principles on how they can develop, improve and promote their responses to mental health issues within their institution. As discussed later in this presentation, the declaration comes at a really crucial time with universities heavily impacted by the COVID-19 pandemic and the wellbeing compromised for many people across the university community, including staff and students. So the momentum to embed responses to mental health and wellbeing into the core business of universities was already growing, but we will never see a time that's more important for action than right now. So just as a quick overview for this presentation, I'll firstly take you through the project origins, so where this all started back in 2018 at the U21 Health Sciences Group meeting in Melbourne. I'll take you through some of the steps that we've undertaken to further develop this declaration, including a number of stages of consultation that we've undertaken with members right across the network. I'll talk you through the final principles that have been endorsed by the U21 Leaders Group and then talk about some next steps as well that have been identified by the Mental Health Working Group. So taking it back to 2018 at the U21 Health Sciences Group Annual Meeting in Melbourne, we were really fortunate that mental health was identified as a core theme for this meeting, and we were able to have presentations running across 2 separate mornings. These presentations covered a range of different areas in regards to mental health and wellbeing. We talked about the prevalence of mental health issues in universities and what was known about it and what wasn't, the impact on students, staff and the broader community when students and staff were experiencing poor mental health. We had presentations relating to student wellbeing within university policies, course design and professional accreditation, and some really great examples of good practice that was already happening across the U21 Health Sciences Group network, and talking about evidence that was emerging for effective mental health interventions in university settings. The sessions generated a lot of discussion, which was fantastic, and a lot of interest from the U21 Health Sciences Group to further progress this work. Professor Satish Kapoor from Melbourne University suggested at the end of the meeting that we might develop a declaration for university student mental health and wellbeing, that we could develop up a set of principles that right across the U21 network and not just the Health Sciences Group, we could see that adopted as a commitment for all universities across the U21 to deliver on. And so a working group was established at this end of this meeting to further progress this work. So I'd like to just take a moment here just to acknowledge the membership of that mental health working group. So we've worked for about 2 years since that Melbourne meeting to continue to drive the development of the declaration and a range of other activities associated with it. I'd like to thank all my colleagues, Professor Barbara Dooley, Professor Michael Grimm, Professor Stuart Carney, Professor Annie Tamane, Dr. Angela Kogan, Dr. Maria Gardane, Dr. Kirsty Hill and Professor Lisa Phillips, Corinna Greenwood, Trudy McGuinness and Rachel Edwards from the U21 Health Sciences Group as well, who have been a fantastic support for this project. One of the first things that the working group undertook was a desktop review of publicly available mental health strategy and policy documents on the U21 network websites. So we found a range of different bits and pieces of information and policies that were available for people to download off university websites, but they served a range of different purposes. It was a bit hodgepodge. So we have lots that are articulating risk management issues and policies and protocols, so particularly around crisis intervention. There was a number of websites that provided information on the services and programs that students could access if they were experiencing any issues. Sometimes it might not necessarily be mental health related issues, but it's just issues that they were experiencing that were being detrimental to their educational participation. There was only a few that actually had policies up that identified a whole of institution response to mental health and wellbeing. So we presented the snapshot of the findings from this desktop review to the U21 AGM at the University of Maryland in 2019. We did go to them with a set of principles at that point in time to form a declaration and seek their endorsement for that. But where there was some support in principle, I would definitely say the U21 principles presidents requested that we further develop the wording of the principles before agreeing to endorsement, and that we further socialise it across the U21 networks, just to get a sense of the support that they would find behind those if they were to endorse it. So in the U21 Health Sciences Group meeting in Glasgow in 2019, we were again fortunate that we were able to have some time at this particular meeting to further discuss mental health and wellbeing. There were 100 attendees at that meeting, staff and students, and the focus was, again, presenting some good practice, but we made it a little bit more interactive this time around, and we wanted to really use the time to get participants to engage in a process where we redrafted the principles, had a look at the wording, critically analysed it, discussed it as a group, and suggested some changes to the particular principles and the way they were worded. But also we wanted to use the time to sort of start to discuss how you might implement it in practice. What were some of the opportunities and what were some of the challenges that we needed to overcome as well? And key feedback from that group was that the declaration needed to be inclusive and not just medicalised. It needed to be about the wellbeing of both staff and students. It needed a stronger focus on stigma, which was really important to many people in the group. So while many people there thought that there had been significant gains made worldwide around destigmatisation of mental health issues, that this progress was not seen everywhere, nor did participants believe that where we were was where we needed to be, particularly in providing parity to the way we discuss and legitimise mental health concerns, to the way that we discuss and legitimise physical health conditions. There was still a sense from many that there was considerable efforts that still needed to be undertaken in that space. And finally, on the issue relating to data collection and monitoring, this was a concern for many, and it's actually been consistent in our conversations and consultations on this declaration. Just to be clear, the intent behind the need for data collection was so that universities could understand the current level of mental health needs within their communities and measure how effective programs and policies were that they had introduced in responding to them. But it's been a bit of a sticking point, and I'll talk a little bit more about that in detail in a moment. So after the U21 meeting in Glasgow, we developed up a survey to get a broader sense across the U21 network. So that included the U21 Senior Leaders Group, the Educational Innovation Cluster Group, the Research Engagement Cluster Group, Student Experience Cluster Group, and the Health Sciences Group. We limited it to the university staff only, as we actually had a small period of time that we were actually able to develop and implement the survey, so we didn't have time to get ethical clearance to engage students, which I do think is a limitation behind this process. But what we did have was representation from universities in 11 different countries around the world, and also people responding from a range of different positions and roles. So 42% of our respondents were in academic and teaching roles, but we also had 1 in 5 respondents who were in leadership management roles, and 36.5% were a mix of other administration, student support services and academic research roles. The way the survey was constructed is that we presented each one of the declaration principles, and we followed it with some questions around how strongly did the survey respondents support that principle, whether they had any changes to the wording of that principle, how realistic they thought the principle was to implement, and if they did think there were some challenges to implementing the principle, what were those challenges? And so I'll just go through the findings with you now, and I'll also give you the principles that we had landed on at that point in time, so you can get a sense of what we were suggesting should be part of the declaration. Principle 1 was that the university commits to its role in creating, promoting and sustaining a positive environment for optimal mental health and wellbeing amongst its staff and students. This principle really goes to the heart of this being a whole of university commitment and core business for the university. And we had 83% either strongly agree or agree with this principle. 57% thought it was moderately or extremely realistic to implement. So that wasn't as strong as we'd seen in some of the other principles. And the biggest challenge, people have said, is quite nicely summarised by that quote on the right-hand side, is it is a challenge when it becomes a responsibility of everyone in the university community and not just those responsible for providing services for those who require support for their mental health. So principle 2 was that staff and students are at the heart of our concern, and therefore all discussions and delivery of improved services around mental health will consult and engage with the individuals it aims to serve. This was well supported, strongly agreed, and also many people thought it was moderately or extremely realistic to implement. It was probably the one that got the strongest response for being realistic to implement. I think where there were a few comments that just sort of flagged things we need to consider in implementing this principle was that people with mental health issues in particular may find themselves more marginalised or might need specific supports or targeted programs to actually engage them in conversations around developing policies and programs that could better support them and other people that are experiencing mental health issues on campus. So we do need to be considerate of that and actually target some responses and some programs and consultations to really make sure we capture those voices as well. Principle 3 was that the university will measure and monitor the mental health of its community in order to gain an accurate picture of the wellbeing of its staff and students. So as I indicated earlier, this description of data collection and monitoring in universities became quite problematic. So while only 1 in 10 people actually disagreed or strongly disagreed with this principle, overall there were concerns and comments around how it would be implemented in a way that would actually be safe for students and staff. So concerns predominantly related to privacy and a perception that information would be used in a way that could be really detrimental to students' academic progress or future employment. As the quote describes, some respondents also felt that reducing this understanding of mental health experiences into these sort of data units reduced our ability to understand how the experience of mental ill health and poor wellbeing impacted people on an individual level and had a very individual nature for these kinds of experiences. Principle 4 was that the university commits to its role in linking staff and students who require additional support for their mental health to professional and evidence-based mental health supports either on or off campus. And this was relatively strongly supported or agreed. Again, actually, it was probably the one that had the strongest support across the survey. 66% of people thought it was moderately or extremely realistic to implement. And I think while people were definitely supportive of it, there were some concerns raised, particularly in the comments, that we can't expect university student services to be picking up the mental health burden of students alone, and that they weren't a substitute for a lack of mental health care that was available within the community. And we certainly found that has come through strongly too in the theme in the work that we've been doing in Australia on developing a mental health framework. So really it is a joint responsibility, this principle, for both the community mental health services and services that are available on campus to work together to make sure students are supported. Principle 5 was that university will contribute to building the evidence base by monitoring and evaluating the outcome and effectiveness of all mental health and wellbeing policies, programs and services delivered by the university. I think in general this principle was fairly well supported, although there were a number of people that flagged they thought it was duplicative of Principle 3 around data collection and monitoring. And given, as I said before, the intent behind the data collection and monitoring was really around informing the evaluations of the effectiveness of different programs and policies, it's probably not surprising. Principle 6 is the final principle that we put to the group, and this was that the university will operate towards a zero tolerance policy approach towards prejudice relating to mental ill health and will endeavour to foster a stigma-free environment of support and understanding. 78% of people strongly supported this principle, but only 58% thought it was moderately or extremely realistic to implement. So there were some concerns there. People really felt strongly about this though. The wording of zero tolerance actually came out of the Glasgow workshop because people, as I'd said before, really thought there was a long way to go in combating stigma around mental health issues and we needed just to get on with it. They saw that this stigma was structurally embedded and manifested in the lack of attention and parity that was given to mental health, not just in universities, but we're talking about in the broader community and government policy, in funding, in research funding, right across the board. So this is a huge issue. There was a little bit of feedback around the wording of zero tolerance, though, in the survey, people finding that was quite combative and potentially a negative way to approach this. So we took all of the input that we got from the consultations, both in Glasgow and through the survey that we put out across the U21 network, and we refined the principles. We refined them down to 5 principles, and we took them to the U21 Executive Committee for their endorsement. As I said, you'll note there's now 5 principles and not 6, which I'll discuss as we go through. Principle 1 largely remained the same, although we did change some of the wording there to really reflect this as sort of a broader university community issue, not necessarily just an issue for the university construct, so that it's involved everyone in the community committing to creating and promoting positive environments for mental health and wellbeing. Principle 2 largely remained the same and had such strong support, and same with Principle 3, although again, just noting as a caveat that this is actually something that requires community mental health services to come on board as well. Now, what you'll see with Principle 4 is that we merged Principle 5 and 3 from the previous version, and we brought the data monitoring together with the evaluation. So we could give the data collection monitoring a clear purpose. This wasn't just about being Big Brother and keeping an eye on what people's mental health and wellbeing was. It actually had a purpose, and that this was around informing and improving and continually improving our responses to this issue. And finally, Principle 5, you'll note that we did actually remove some of that wording around zero tolerance, but I think it's still very clear that this is an issue that needs to be taken very seriously and addressed promptly. So I just wanted to quickly touch on the fact that this declaration is really complementary. It's just not sitting out there on its own. There are a number of pieces of work that have been happening around the world for which the declaration sits really nicely. There's the University's UK Step Change Framework, which was updated and released in May this year. The University Mental Health Charter, Student Minds, released in 2019. Both of those pieces of work have been focused on the United Kingdom. Over in Canada, the Mental Health Commission of Canada has been developing post-secondary student mental health standards. They're due out later this year. And in Australia at Orygen, we've been developing an Australian University Mental Health Framework, which is also due. So the declaration principles are consistent with what I know to be the key themes and principles across all of these documents. So it is part of a broader international community and movement to being able to really embed in core business of universities a mission to make sure that students and staff have the best mental health and wellbeing possible. And I also just want to do one final slide that's sort of touching on COVID and the COVID pandemic. So I do want to really acknowledge that this situation has brought unprecedented levels of disruption to the sector. I know that you will have talked about it a lot through this meeting already. In regards to mental health and wellbeing, we're seeing increased anxiety and distress for both staff and students. There's disruptions to learning. There's insecure or unstable employment issues for university staff at the moment who may be feeling like their positions are under threat as university revenues are taking a hit as well during this period. Also for staff, they're experiencing insecurity in their employment and or a complete loss of employment, as many students will be employed in those industries that have been completely shut down through the response to the pandemic, so hospitality, tourism and the retail sectors. Shifting to online delivery, both for learning and also for the student services provision, has been necessary. In some ways, it's actually brought around a lot of benefits, but it's been a really rapid pivot that's meant people have worked a lot of extra hours and a lot of extra time, and it's been quite a stressful period while they've adapted to a new way of delivering learning and also student services. And finally, there has been a massive impact on international students, some who haven't actually been able to get to the country of their study and actually commence their studies this year, or some have found themselves within the country and needing to go home, or within the country and actually not being able to access the kinds of supports, accommodation and other kind of financial supports that they need. So it's within this context that we see this declaration as being really crucial and important to keep working on and keep looking to see ways we can implement it and share practice across the U21 network. We want to continue to promote this declaration, and we want to be able to create a repository and a resource section on the U21 website that's going to be able to pull together a range of different case studies, links to information and other good practice examples of work that's actually happening across the network which demonstrates these principles in action that others can look at and learn and be inspired to implement similar things in their universities. So if you have a case study or other information to share, we'd love to receive it, and I've included Karuna Greenwood's email address here. You can get in contact with her. And also, we're also very welcoming of new members to our mental health working group as well. We've been doing this for a couple of years. Some new members would be fantastic, so if you're interested, again, contact Karuna. I'd just really like to finish off by thanking you so much for your time today coming along to this session or downloading this session to listen into it. Your clear commitment to this issue is demonstrated by coming along and being interested in this topic. And I'd really like to give a particular thanks to any of you here who contributed to the development of the declaration, particularly my colleagues on the working group, but also any of you who have participated in the consultations in Melbourne, in Glasgow, and in the survey. I hope that you and all your family and loved ones are staying safe and well during this difficult period, and I thank you once again for your attendance. Take care, bye.